is here, and we're going to be talking some health stuff here. Especially there's not much to talk about when it comes to COVID these days, which is a good thing. The only news item really I can find here is something to do with the airlines, but probably it's saying that the UK's aviation watchdog should have stronger powers to protect passengers hit by the kind of disruption caused by the pandemic. MPs are saying the sector was hit hard by efforts to tackle the virus, including quarantine, testing regimes, and travel bans. The Civil Aviation Authority should have more teeth to be able to fine airlines, not giving funds. The Commons Transport Committee said. So it's not really about COVID, is it? It's about the effects of COVID, vis-a-vis what the airlines should be doing, like compensating people and stuff like that. What's your opinion on this one?
Yes, well, I think as you've said about this situation, I think it's probably going to see more things like this. I think, I don't know. Well, what's your understanding of the whole with the airlines and the airports?
You threw the question back at me, didn't you?
It's a difficult one. I don't know. Yeah, what do you feel?
Yeah. Well, I think to be fair to the airlines, they're suffering because of the whole pandemic situation. People are not traveling, or people were not traveling as much as they should. So the airlines are suffering a bit. So it would be really difficult to, give people a lot of compensation and all that. So
yeah.
At the same time, they should be doing what they should be doing. So that's my opinion on that.
Yeah, but to be honest, a lot of people are traveling a lot more than what we did in the last 2 years. So it's opened up so much that people are using the opportunity. So I think as much as we've had that dip or that, the difficulty for the industry in terms of tourism, travel and hospitality, I think now that, most of the restrictions have been lifted, globally. So I think we will see an improvement in it. So I think it's just temporary that people will be concerned about this. Yeah.
Let's talk, because obviously there's not much news on the COVID situation, what's going on and all that, because we're getting used to it. If not used to it already, we're getting used to COVID. We're facing it and not fearing it, and we are not as many deaths as we saw. Of course, every life matters, but I like to see that the situation is getting better in terms of COVID. So we don't have much news on it, but can you run us through some of the effects of COVID? I mean, I'm talking health, mental health, physical health. I'm not talking economics at all. I'm talking about the health situation, the effects of that COVID had on us.
Yes. Well, in terms of COVID, when someone got infected, they had the, sort of mild, moderate or severe symptoms. So it could have ranged from mild symptoms of just having a new persistent cough, a fever, temperature 37.4, and then the other symptom was anosmia, so the loss of and also taste. So those were the main symptoms. And then later on, if people had more severe symptoms, they'd have fatigue, muscle aches and pains, difficulty in breathing, and sometimes even what happened was that people ended up into ICU because they had to go on a ventilator because of the effects on the lungs and the breathing. So that's obviously the mild, moderate and severe end. And I think what you're asking is what happens after COVID. So after you've recovered from COVID, what are the effects? And there are some significant effects of Opoku, and I think a lot of people are still experiencing it. So in terms of the physical health complications, I would say that some people are still find it difficult to breathe. Some might have the effects where they're struggling to breathe day to day. And their breath is catching. Some might still have a persistent cough. And I think the main thing is the long COVID symptoms, the extreme fatigue. So the fatigue can present in different ways. Yeah. So do you want me to carry on?
Mm-hmm. Yeah, please go on. Yeah.
Yeah. So in terms of the fatigue, what people have noticed is that they can become extremely tired. So immediately after the infection, up to, I think, even, anything from the time you've had the infection and you've recovered to maybe 3 months, 6 months, 9 months, even up. It might be even longer, but I think that's the time period we're looking at where people can experience this extreme fatigue, so tiredness. And with tiredness, as we know, if someone is tired, their motivation will decrease, concentration will decrease. It will affect their mood as well. It will affect them in terms of, if your concentration gets reduced, they will then have difficulty day to day, even completing any simple tasks. So the effects of long COVID can be quite it can have an impact on someone's day-to-day functioning to the extent that a person will find it very difficult to manage. So even simple tasks, simple jobs, even with their work or with just their day-to-day routines, driving, reading a book, so that extreme fatigue will affect them in all aspects of their life. So I think that's the main thing I would say from the COVID. We do have others, so in terms of the psychological effects, so the psychological consequences and sequelae of COVID. So the initial ones that we did have was obviously the coronaphobia and chronophobia, where people had that extreme fear of catching COVID. So it's either you're on the, like now, I'm still going into the shops with masks, I'm wearing a mask to work, but you might get people that are, extremely, extremely fearful of getting COVID again. And they would be maybe washing their hands 20 or 30 times, or using hand sanitizer all the time, and wearing a mask. So their behavior might be to an extent where they're extremely fearful of catching the virus. So that's the chronophobia and coronaphobia. Then in terms of the other effects, we know that as a result of COVID, there has been a lot of, when you've had the infection, I'll start with that first. So people do experience PTSD, so post-traumatic stress disorder.
Yeah, yeah.
Yeah. So I think when we've reported previously, Apoku, you remember there were stories where people experienced severe symptoms of PTSD, and the Royal College of Psychiatrists actually reported on that quite early on, where where a lot of people, because they had been maybe admitted into hospital, they had the difficulty in breathing, they had to go on a ventilator, which was quite serious. When they recovered and they came out, they actually had severe PTSD symptoms, so post-traumatic stress disorder. I don't know if you want me to go into detail about that, but I'll just mention that, and then we can move on to all the other psychiatric effects and psychological sequelae of COVID. Yeah. So PTSD was reported. So it is something that if someone is experiencing any symptoms of PTSD as a result of having COVID, then they do need to seek psychiatric help, and we can talk about that. In terms of other effects, so people that were in isolation, and also, people on their own, people who have lost loved ones, they would have gone through grief. So grief is something which, as a result of COVID, has been significant, I would say. So some people might have had COVID, their family members have had COVID, and we know quite a few, and then you've lost someone because of COVID. Yeah, so we've all had to go through that focus. So grief is another significant impact and consequence of COVID. So grief, again, if people are experiencing it, they do need to get more help with that. So coming to the isolation bit, as a result of isolation, and if people had already had an underlying psychic diagnosis, so some people might have had depression or an acute stress reaction, adjustment reaction, might have had other sort of illnesses, mental disorders already OCD, panic disorder, anxiety disorders, schizophrenia, bipolar, dementia. So anyone who has had already COVID-19, and then if they've had an underlying psychiatric illness, it would have affected them as well. So would have affected them to the extent that some people may have relapsed. Or even if they didn't catch COVID, if they didn't have COVID, but they had underlying mental health problems, what we did see and what the Royal College did report is that we started to see a tsunami of mental health disorders. And there has been a lot of emphasis, on mental health since then. Coming to depression, which is obviously the main one I hadn't mentioned yet, but as a result of isolation, a lot of people could have had depression as well. Depression could have been a lot of external factors or internal factors. So external factors are any stresses. So maybe they've lost someone, they had gone through financial difficulties, they had a relationship problems or divorce. They've had other financial difficulties, like maybe losing a job because of COVID. So the impact of that and getting depression could have resulted in someone being severely depressed, so mild, moderate, or severely depressed. And when you become severely depressed, some people might self-harm, harm themselves, might end up being suicidal and committing suicide, or might just have suicidal thoughts and attempts of cutting themselves or taking overdoses. Others with depression or any other mental health problems or difficulties and stress might have started to experiment with drugs. So we have seen an increase in all these conditions, difficulties in relationships, especially depression and self-harming behavior, and also people experimenting and using drugs, so illicit substances and alcohol dependence. And as a result of this, why I'm touching on that is as a result of something which doesn't get talked about is obviously domestic violence. So because of the relationships and difficulties, there has been an increase in bullying, domestic violence, victimization, stalking. So lots of other problems has been the effect as a result of COVID-19. So there is a lot. But as we've discussed a lot of these conditions already, I've just given a snapshot of the main things which could have.
No, that's really good. That's really good. You've said it all, to be honest. There are a few questions on my mind that I need to ask.
Go on.
Let's start with the fact that you remember when we started doing this COVID update. Every day was so many people in ICU. Every time, even here in Bedford Hospital, there were a lot of people in intensive care all around the country and all around the world. ICU. And so, remember, certain hospitals had to, they couldn't cope anymore. They had to send patients to other hospitals, and there was a proper breakdown in the health service and all that because of ICU situations and all that. Suddenly, you feel that we don't even hear of people going into ICU because of COVID. What do you think is contributing to this? Would you say it's because of the new variants that are bringing up their heads, or is it because we now know the disease and or we now know COVID, so we sort of can't fight it, or is it both? Or what do you think is the cause?
It's because there was a lot of different, in answer to your question, there's been a lot of different contributions made to COVID-19 in terms of managing it. So I think that has helped. So I'll tackle each one by one. So as you rightly said, Opoku, it was because we know a lot about the illness. Yeah. So we do know a lot. There's a lot of awareness, education around COVID-19. So we know that as a result, because of the awareness and education, um, people have understood more about COVID-19. So that's been number one. Number two, I would say it's because in terms of treatments, we've had a whole range of treatments available. So in terms of the medical treatments and oxygen availability, that's been readily available in hospitals and other institutions globally, as a result of obviously the World Health Organization as well and their input. I think so. And with the treatments, the vaccinations have been important. I would say we have probably some people might underestimate the effects of the vaccines, especially those who haven't taken it. But the vaccinations have definitely helped us, and we've had a massive. If you think about the millions of doses.
Yeah, I was actually going to mention. The vaccination, and it just skipped my mind. So it's a good thing that you're bringing it in. Yeah, but that has helped, hasn't it?
Yeah. What's your view? Your personal view? Yeah.
Oh no! I agree with you, and I would want you to continue with answering the question. Sorry, I had to budget because I wanted to ask you about the vaccination and to include that in the question I asked you, and then it skipped. So, it's a good thing that you're mentioning vaccination because it has helped, hasn't it?
Yes. So yes, the vaccinations. So I think that, and the fact that we had vaccinations developed. Do you remember the conversations we had since last year? So since Feb 2020, isn't it? So we used to talk about
2nd of February.
Yeah, so we used to talk about the vaccinations and how quickly they were developing the vaccinations and what was going to be the outcome, because it was within months, like 6 months, that we saw the rollout of we saw the piloting of the vaccines first before it was approved. So the vaccinations have definitely helped. So that has helped immensely to reduce this effect, as you were saying, of hospitalization. We're not here for a long time. We haven't heard of people going into hospital and then ending up in ICU. We heard about it very early on. But in the recent months and since we've had the vaccine rollout, there's enough evidence to suggest that the vaccines have reduced hospitalization. It's reduced the effects of COVID-19, even if someone did get infected and they were vaccinated. And there is evidence to suggest that if people did not get vaccination, then there was a higher chance that they developed complications as a result of COVID-19. So there's a lot of evidence for the vaccine and obviously against if you have not been vaccinated. But as we've always spoken about, it's a disclaimer. We only give advice and we only report on what's topical and what's in the media. And if you do need any further advice, you do need to consult your GP or health practitioner.
I like to say, because you've got this vaccination in and talking about the possibility of getting COVID after you've been vaccinated. I like to say for the first time on this show that I did get COVID, but I didn't get COVID until I had been fully vaccinated and boosted.
Yes.
And I must say that I think the vaccination really helped me because I didn't have any symptoms at all.
Yeah.
But I tested positive, and then I self-isolated. And you can decide to answer the question or not. Did you get it?
I haven't. Would you believe I have not?
Oh, you're one of the few lucky ones there, because my daughter didn't get it as well.
Yeah.
So
it's interesting.
You're one of the few lucky ones.
Yeah, it's interesting you saying that when you did get vaccinated and you did test positive, you didn't have any symptoms. So this is why we are saying that the vaccines have helped. Fortunately, I have not tested positive at all, and I've done numerous PCR tests. But I think what the government is hoping that there would be sort of herd immunity still. That people will still, obviously, most people will test positive. And as you said, you tested positive, but you didn't have any symptoms. So a lot of people have had that experience, and you've been fully vaccinated.
It's only because I do random testing, and then not random. I test quite often.
Yes.
And the day before I did it, and there was nothing. The next day I did it, and I got it. It was like positive. And just after 3 days, I tested again. It was negative. Yeah. So I thought, oh wow, is this the COVID we're talking about? If you know what I mean? Because I don't know. I don't know why, but I think I know why. I think the vaccination helped. Yeah. Because I was fully vaccinated and boosted, that really did help. Now, another question I'd like to ask, because people ask me this question all the time: how many times can one catch COVID? I know people who've had it twice. I haven't had anybody who's had it 3 times anyway. But how many times? What's the possibility of somebody catching it more than twice?
I think there's a huge possibility. I think there's no limit to the amount of times you can get COVID-19. And I do know of people that have had repeated infections of COVID-19. And I think the different strains, you were asking about the strains earlier on and the variants. Yeah. So if there's different variants, then obviously people are going to get infected. I don't think there's any limit. But I do believe, and there is evidence, as we've discussed, that if you do get vaccinated, it reduces the chances of you getting COVID-19. And even if you do get COVID-19, then the symptoms are much less. Just while we were talking about the other aspects of why, we haven't seen as much hospitalization and complications as a result of COVID-19 in terms of being in hospital. I think apart from treatments and education, I think the other aspect was that people were protecting themselves. When the guidance came out. Yeah. About when we first heard about COVID-19 from Wuhan, China, Dr. Tedros and his team, the World Health Organization, they announced very early on that we needed to wear masks and we needed to hand sanitize, maintain social distance, and isolate if we had any symptoms. So I think because this has been for about 1.5 years, 2 years, we had been hearing about it. And I think it sort of became natural for everyone to follow with this guidance and with whatever changes we had to adhere to, whatever, Boris Johnson, the SAGE team and Downing Street had to announce. And Sajid Javid, whatever the health minister announced, we would follow that, but also people had the knowledge and the guidance from the World Health Organization. So I think that has helped a lot, in terms of people not being hospitalized. And even, I must say, we were talking about the travel industry. I think the travel industry did very well because we know that traveling was one of the ways in which this virus was being spread. Because, it traveled from one country to the next or one city to the next. So the travel industry put a lot of restrictions. And that was also, again, because of the government. So I think that also has helped. So there's been different strategies, different treatments available, different campaigns and awareness, and obviously the vaccines. So I would say it's a combination, a lot of different aspects, and not forgetting the NHS, Opoku. The heroes and the NHS heroes that have worked. There were people that were working on the front line, and so obviously they had the experience. They knew exactly what they're dealing with. If someone came in with these symptoms, people were isolated. They were started on treatment and they were managed. So we're really thankful to the NHS and to all the people working that managed it, because if they did not have the knowledge and the understanding and the treatments available, we would not have managed this pandemic.
Yeah. I was reading last week actually on this. I can't remember how many days apart, but I think it's about 10 days. This person who had COVID twice in 10 days, or sort of the shortest time frame. Don't quote me on the number of days, but I think it's 10 days, because that person had, I think, the Delta variant, and then tested negative, and then had Omicron. But then again, this person is alive and well, so we're getting there. All right, we just got like 6 more minutes to go. So if we do don't discuss the numbers, see what the numbers are like around the world.
I will. And then, do you remember when we spoke about, you mentioned when the Omicron came up, Then you said, oh, yes, it will be like another
Yeah.
variant that we'll hear about. Do you remember?
Exactly, I did, yeah.
Yeah.
I remember.
You said, yeah. So it was exactly like that. The Omicron came. We started to hear about Omicron, and then all of a sudden, we haven't heard much about it. So,
Nothing.
and it was Delta variant.
Yeah, that's true.
So, yeah. So,
yeah.
So it was just interesting the way well, I just wanted to mention that because the way you mentioned it, it just reminded me of exactly what you said. So our predictions, we had predicted quite a bit during the COVID-19, and so, but it's been great. So it's good to see that, there hasn't been much to talk about, but there has been in terms of obviously just reflecting on how we've managed this journey. How people have coped, and obviously people are still coping, but everything seems a lot more positive, and people are a lot happier, and living with COVID, as you say, and not fearing it. They're facing it. Yeah. So in terms of the worldometer, I've got so in terms of the global figures as of today, the 25th of April, 509,613,088 positive cases globally. Total number of deaths is 6,243,513, and total recovered is 502,174. So that recovered, which is a large number. So in terms of the top five, and I'll include UK as number 6. So USA is number 1, sorry, with 82 million. 82,662,748, with positive cases with over 1 million deaths, which is quite significant. So 1,018,335. So that's quite. That's the highest in the world.
It is. It is. India is nowhere close to that.
Yes.
The deaths in India is nowhere close to the United States.
No, and none of the other countries. So India number 2 with 43,060,086 positive cases, with 522,223 deaths. Brazil number 3 with 30,349,463 positive cases, with 662,701 deaths. So they are the so they are the ones that are closer to USA, but obviously not anywhere near a million. France number 4 with 28,303,931 positive cases with France, with 145,060 deaths, and Germany is 24,140,700 positive cases, with deaths is 134,646 deaths. And then we've got England, which is just after Germany, number 6, with 21,933,206 positive cases, with 173,352 deaths. Yeah. And then we'll just go to we'll just do South Africa's number 30 with 3,762,000.
Number 30.
Yeah, 30. Yeah.
It's gone way down now, isn't it?
Very much, yeah. So 3,762,911, with 100,303 deaths. And then do you want me to do Nigeria still?
Yeah, sure, yeah.
So 102 in the world, with 255,685 positive cases, with 3,143 And we've got Ghana is number 116 with 161,124 positive cases with 1,445 deaths. So Ghana has done really well, and Nigeria. So the African countries have done quite well. So I'm just going to go into UK 24-hour figure, and that will be the figures done. So in terms of the UK figures, we've got 11,393 new cases with 320 new deaths. So that's in the last 24 hours, yeah.
Okay, thank you very much, Dr. Seshni, for always being there.
Yes.
1 minute past.
Sorry, I forgot to mention it was Ferdinand's birthday. So yeah, on the 21st.
Oh, it was,
on the Queen's birthday. So yeah, so that's why the weekend was just all for Ferdinand.
Oh, so that was celebrating Ferdinand's respect.
Yes.
Fantastic.
So it was great
I'll have to call him
celebration.
and give me that. Yeah, I'll have to give me a ring and say happy birthday. I haven't done that yet. I should do that.
Yes, and we went to a South African restaurant on his birthday.
Where's that?
So it's called Ocean.
Where was that?
So it's in Bromley.
It's called what, sorry?
It's called Ocean Basket.
Oh, I see.
So we'll have to look that up. Funnily
enough, just this morning, Jeff White and I, we were talking about Bromley.
Really?
We were talking. He was telling me a story about the hotel in Bromley.
Oh,
just
really?
This morning before I went on there.
So yeah, so it's a very, you should visit it. It's a seafood place. So it's a chain of restaurants in South Africa. It's Greek, but it's a South African introduced. So anyone from South Africa will know Ocean Basket, but you do get some of these restaurants in Mauritius and other countries, but it's all seafood. Okay. So it's only recently opened, about 2 months in Bromley, but it'll.
Oh wow!
Yeah, but the seafood, the prawns. I think you like your seafood as well. So prawns, calamari.
Yeah, I do.
Oysters.
I grew up on the coast, so that's what I ate all the time. Seafood, fish.
Yeah, so we had a lovely time.
Oysters,
yeah, so it was actually why I'm mentioning it, because it reminded us of South Africa as well. So just being there and being in the restaurant, and and it was a kid's first experience of that in the UK. So it was quite nice. And
that's fantastic.
So we had a lovely time. So definitely worth visiting the Ocean Basket. The service is great, food is amazing. It's absolutely delicious. I just told Ferdinand today I want to go again. So maybe I can meet you and Jeff White. We can do a lunch in Ocean.
That would be great. That would be great. That would be great. Anyway, thank you very much, Dr. Seshni, and happy birthday belated though to Ferdinand. And I'm going to play a song for Ferdinand right after.
I will tell him happy birthday again to Ferdinand, and also the Queen. It was her birthday on the 21st.
Yeah.
And
yeah, absolutely.
Yeah, so happy birthday to the Queen. And today there's 2 birthdays, I think. It's a friend, Claire, and Debbie in South Africa. So happy birthday to them.
Wow.
I think I've forgotten a few others, but happy birthday to whoever's celebrating their birthdays, and hope they have a wonderful day. Thank you. God bless.
Fantastic.
Have a lovely day.
Yes. And you. That was Dr. Seshni Moodley, a consultant psychiatrist.